Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Lorrie Roffelsen, RD. Lorrie Roffelsen is a registered dietitian at Washington Hospital Healthcare System. Lorrie completed her studies at San Francisco State University. She is a prominent speaker for Washington Hospital's community outreach educational programs.
Hi, good evening. How are you all doing tonight? I always enjoy coming to speak at Diabetes Matters, and I get here usually about once a year and get to share some information with you. And so the topic tonight is top foods for heart health. And I do a lot of talks on heart healthy eating, so some of this information is may be familiar to you if you've come to some of our other talks here. What I hope you go away with tonight is understanding the diabetes and heart disease risk, the connection there. Learn about what heart healthy diet recommendations are for people with diabetes, and remember some of the top foods for heart health that I talk about tonight. So there are a lot of dietary and lifestyle risk factors that influence our risk for heart disease. One of them is high blood pressure, and that can be influenced by a high sodium diet, a high intake of unhealthy fats, and that's specifically saturated fats and trans fats, so we're going to talk about those tonight. High intake of dietary cholesterol, oxidative stress, and having diabetes does increase your oxidative stress in the body. Being overweight increases your risk. If you're a sedentary person, a lack of exercise and activity can increase your risk. And if your diabetes is uncontrolled, your risk is greater. And so that's what we're going to talk about tonight, is controlling your diabetes to help decrease your risk for heart disease. So we know that, these are some of the statistics relating heart disease and diabetes. So hypertension is twice as common among people with diabetes and the general population. And 65% of deaths among people with diabetes are due to heart disease and stroke. And heart disease death rates are 2 to 4 times higher among people with diabetes. So the risk is definitely there. So what's the connection? What is it about diabetes and heart disease? It's actually a very complicated process in the body, and having diabetes and high blood sugars causes a lot of changes at the cellular level and inside our vascular system. We know diabetes increases blood sugar levels, and hyperglycemia can cause a lot of changes within the body. It can increase hypertension. It can change our blood lipid levels, can lower our good cholesterol level, our HDL, and increase levels of LDL cholesterol. It can increase inflammation in the body. And all of these changes can increase our risk for blood clots, for plaques in the arteries, and that can increase our risk for heart attack and for stroke. So the goals that we're going to talk about tonight regarding nutritional management are to reduce the risk for heart and kidney disease and long-term complications from diabetes. So to know if what we're doing is working, we have to measure something. There has to be some parameters we look at. So we measure glucose control, blood pressure, and lipid profile, because if those things are controlled, your risk is reduced. So we're going to talk about how to control our ABCs of diabetes. So A, just remember, stands for A1C, and that is your A1C is your average blood sugar control over the last 2 to 3 months. So how many of you know what your last A1C is? Raise your hand if you, okay. So that is, the doctor will order that usually about every 3 months or every 6 months when you see him. And it gives him an average of what your blood sugars are doing at home. It doesn't tell him day to day exactly what's happening, but it gives him a kind of a picture, a snapshot of what's happening. And the goal generally is below 7. Your doctor might have a different goal for you, but generally it's below 7, which equates to an average blood sugar of about 150. B is for blood pressure, and you want to control your blood pressure generally below 130/80. How many of you check your blood pressure at home at all? Okay, good. And C is for cholesterol, and that actually refers to 4 numbers, not just cholesterol or your total cholesterol number, but also triglycerides and HDL and your LDL number. And we'll talk about those more. But that is, so those are the 3 areas. And so now we're going to talk about the dietary things you can do to control all these 3 areas. First of all, to control your A1C, you have to control your blood sugar levels. And the starting point or the cornerstone of that is knowing what foods raise your blood sugar. And we know that foods that have carbohydrate are the main foods that are going to raise your blood sugar level. So you have to know what are sources of carbohydrate. And then you can, from that point, begin to control them, look at portions, see if you're eating excessive amounts, and maybe change the way you add them into your meal plan. So sources of carbohydrate include starches, like breads, grains, cereals, and things we make from grains like pasta. Starchy vegetables, we also count because of their carbohydrate content, so corn and peas would also be included. Beans and lentils are also starchy, but we're going to talk about those a little bit later. Fiber, so you know, starches do also have fiber. Some of them have some undigestible part, which is also considered carbohydrate, may not really affect the blood sugar very much. And then sugars are also a source of carbohydrate, and they can be natural sugars like you find in fruits. Vegetables to a lesser degree have carbohydrate, so even spinach has a very small amount, but it even has carbohydrate. If it's a vegetable, it has some carbohydrate in it. And someone raised his eyebrows. That doesn't mean don't eat your spinach. You still want to eat your spinach. So we have natural sugars, and then we have added sugars. Sugars that are added to foods like candy or soda or pie or table sugar. Those are all added sugars. In the body, they get processed and changed to glucose, and the body uses that for energy. So they shouldn't be excluded from the diet, but you have to look at how much you're consuming and how you're adding them into your meal plan. So let me give you some strategies for glucose control. When we see patients in our outpatient, we don't have a set printed meal plan that we give everybody that's the same. We have to individualize it based on what you eat, maybe your own cultural foods, your age, your activity level, all of that. So you have to have sort of an individual meal plan based on all those things. Typically, it helps to have some energy restriction, meaning cutting calories a little bit will help with glucose control. And that will probably assist with mild to moderate weight loss, which will also assist with blood sugar control. So anywhere from 10 to 20 pounds, if you're overweight, will help you improve your blood sugar control. Regular exercise also improves your blood sugar control. And to see what's working for you and what isn't working for you, you should be self-monitoring at home with a meter your blood sugars. Because that A1C the doctor does periodically doesn't tell you day to day what's happening. So you could have a great blood sugar every morning when you wake up, but your A1C is, 8.0, which means you're high somewhere else during the day. So if you're not checking on your own, you may not be, figuring out where you're running high. Maybe it's after dinner, or maybe it's at lunchtime. And you can make some changes if you figure out when it's happening. So that really means lifestyle changes for improving glucose control. I like to also talk about avoiding peaks and valleys with your blood sugar levels. So every time your blood sugar spikes up, or you have what we call high or hyperglycemia, it puts oxidative stress on the body. And that's what can lead over time to heart disease. So we want to avoid that oxidative stress, avoid spikes in your blood sugar levels. So one thing that helps is regularity, trying to do, not that you have to eat exactly the same thing every day, but try to be somewhat regular in your routine. And some people are very regular, they like to eat the same things day to day, and other people I talk to say, sometimes I don't feel like eating, I just don't eat anything, or I skip breakfast and I don't eat till 1 o'clock, and then I eat again at 10 o'clock at night. And it's a very irregular pattern. And they tend to have blood sugars that are kind of all over the place. So try to think about regularity. Try to eat at least 3 meals a day, so you're spreading out that food. Just think, if you eat a great big meal once a day, your blood sugar will go up very high after that one meal, compared to if you spread out your meals and have at least 3 smaller meals during the day. Your blood sugar hopefully doesn't go up as high after you eat. Try to eat about the same amount of food day to day, especially when we're talking about carbohydrate, and about the same time. You don't have to eat on the clock the same time, but it does help, again, with regularity. Try not to skip meals. Also, depending on what type of medicine that you're on for diabetes, that can cause, drops in your blood sugar, which you're not going to feel well when that's happening. And then often people will rebound. They, have a low blood sugar, don't feel well, so they go have some juice, or they go eat to compensate, and then their blood sugar may, rebound up too high the other way. So by not skipping meals, hopefully you keep your blood sugars steady. And try to space meals at least a couple hours apart from snacks or from other meals. So you don't want to go into a meal with your blood sugar higher because you just ate a snack. So you want to give your body time to process what you ate and get that blood sugar back down to hopefully a fasting level before you eat again. I was going to just talk a little bit about using the glycemic index. This is a ranking of carbohydrate foods based on how quickly they will get digested and absorbed and raise your blood sugar level. It's not used routinely in our outpatient diabetes program. It's not really endorsed 100% by the American Diabetes Association yet, because there's things that still probably have to be researched about it. It can be helpful in some ways, and we're going to talk about that. When they developed the glycemic index, they took test subjects, gave them a measured amount of digestible carbohydrate, like a piece of watermelon. And And they used the same amount, 100 grams of watermelon or 100 grams of carrot for each subject that they gave the test food to. So they ate that food, and then their blood sugar level was measured 2 to 3 hours, or over 2 to 3 hours, to see what's happening, how high it went, or if it's starting to come back down. And so that rise was compared to a reference food like pure glucose or white bread, to see how high did each of these test foods cause the blood sugar to go. Generally, the foods that were ranked as a higher index or higher glycemic index food would spike the blood sugar higher after meals. So they were ranked based on that. There's a lot of factors that influence the glycemic index value of foods. Depends on the starch structure, the fiber content. So what they found was soluble fiber slows down the digestion, the passage of the food, the absorption of the glucose. And so they saw a lower glycemic index or slower rise in the blood sugar with foods that have a lot of soluble fiber in them, like beans, lentils, peas, those kind of foods. So even though they have carbohydrate or starch in them, you know, they probably will rise or cause your blood sugar to rise slower after you eat them because of the soluble fiber they have. So examples are fruits and vegetables. You know, there's, if you go to the American Diabetes Association website, and at the end of the presentation their link is there. They give an example. There's a list of glycemic index and foods and how they're ranked. And you'll see some of the fruits are lower glycemic index, so it kind of depends on how much soluble fiber they have in them. So fiber content is a factor. Presence of fat and protein. Those two factors also slow down the digestion and the rise in the blood sugar. So if it's a food that has fat or protein in it, like ice cream, it has a lower glycemic index. But we also know ice cream has a lot of sugar in it. So that's where the glycemic index isn't always the greatest way to gauge if a food is really a good choice or not. So those two factors do also slow digestion and rate of absorption. Food processing also affects the glycemic index. So for example, steel-cut oats, which are kind of, they're less processed. They're the solid, you know, particle of the grain, compared to quick cooking oats, which are a smaller flake. The steel cut will have a lower glycemic index than the instant oats. And you can also experiment on your own at home with, you know, different foods and check your blood sugar after you eat to see what happens. The other factor is a mixture of foods at meals, because for most of us, we do eat mixed meals. We don't just have lentils, or we don't just have usually oats. We might also have an egg, or we have milk. So the mixed meal does impact what the overall glycemic index is going to be for that food. So, you know, bottom line is the glycemic index value is less important than the total carbohydrate or the combination of the meal that you're eating. So I just want to give you an example of a few select foods and their glycemic index. So cornflakes, because of the way the grain or the flake is processed, it's digested very quickly. It's absorbed, you know, it's an easy to digest food, so it has a higher glycemic index. Even though cornflakes don't have a lot of added sugar or anything, if you look, they may have, I think they do have some added sugar, but they're not a sugary cereal compared to like Frosted Flakes. Instant oatmeal compared to old-fashioned oats, you can see the difference, 79 versus 55. White rice compared to brown rice, not a huge difference. They both have, now at the top, I kind of explain, if it's above 70, it's considered a high glycemic index food. Between 56 and 69, it's a medium glycemic index, and below 55 is considered low glycemic index. So on the list there we have lentils, which are 32, soybeans, which are 16, non-fat milk, 37, an apple, 36. You know, apples have a lot of soluble fiber, so even though they have sugar, they have a lot of soluble fiber, so they have a lower glycemic index. Watermelon I put at the bottom. Watermelon, 76. Well, again, this is just, it's something you can use as a tool as part of your meal planning and decision making. The take-home message with glycemic indexes, the recommendation now is try to eat mostly a plant-based diet that has minimally processed grains, so you get the fiber from those grains. Eat legumes like your beans and peas and lentils, and vegetables and fruits. Try to eat mostly those foods because those are, for the most part, lower glycemic index. So the potential benefits of eating more of the low glycemic index diet is still being investigated because there's many variables in the glycemic index depending on the meal consumed, the quantity you consume, and how the food was processed and cooked, how ripe the fruit was, and then there's also variability from person to person. So you and I could eat the same exact amount of carbohydrate and meal, but we're going to probably have a different response just because there's so many variables. And then the other thing is there's a lot of variability among the published glycemic index of foods based on who did the study. So unfortunately, they haven't all gotten the same numbers when they've tested watermelon or tested apples. The numbers aren't exactly the same. So that's another reason there's still things to be worked out with glycemic index. So this should cover the A of our ABCs, or glucose control. Now let's talk about sodium. In countries that increase their intake of salt and sodium, we also see a rise or increase in blood pressure. And conversely, when there's a decrease in sodium intake, there's also a decrease in blood pressure seen. Sodium is an essential nutrient in the body, but we only need about 500 milligrams a day, very, very little. And in the American diet, it's primarily consumed as salt or sodium chloride. We use it a lot in processing for curing, preserving, flavor, retaining moisture, flavor enhancer. And the majority of sodium in the American diet comes from processed foods, packaged, processed convenience foods, and also restaurant food if we're eating out. The salt that we add at the table or add in cooking is really a small percentage of the sodium in our diet. So really when I talk to people about reducing sodium, I'm not as worried really about the salt shaker and maybe the salt they're using in cooking, but what they're cooking with also. Are they using fish sauces, soy sauce? Are you buying packaged soups and rice mixes and things like that, which have a lot of sodium in them? So some tips to control and lower blood pressure: regular exercise and activity. If you can do this, adults should aim for 150 minutes a week, which equals 2 hours and 30 minutes. So any which way you want to divide it and fit it in. If you have to do 2 hours in one day, or do 30 minutes, or do 15 minutes twice a day, try to get in some regular exercise. Moderate intensity exercise like brisk walking, bicycling, dancing, swimming, that kind of exercise. Maintain a healthy weight or lose weight if you are overweight. Limit alcohol consumption because that can also increase your blood pressure. And of course, reduce sodium intake. So I'm going to give you some strategies to do that. One way is reduce sodium from processed food sources like cured meats, cured fish, salted fish, canned vegetables and soups. I do see more and more low sodium or no salt added options at the stores. So I think manufacturers are responding to pressure from the government, pressure from consumers to have lower sodium options out there. And they kind of have to, because the recommendations now for sodium intake are quite low, especially for people with high blood pressure or diabetes. We're talking about less than 1,500 milligrams a day, which is very low, and you can't achieve that if you buy processed foods at all. So they have to respond and try to manufacture foods with less sodium. What you can do at the store is read and compare food labels, because there is a big difference often between different brands. Try to reduce salt in cooking. Also from added things like fish sauces and soy sauce. And try to follow these habits when you eat out. Since people often eat out, how many of you eat out at least once a week? I do. Yes, okay. How many of you eat out daily? Anyone? Okay, some people. So then if it's a regular part of your routine, you've got to try to pick things when you're eating out that are also reduced sodium. And a lot of restaurants will accommodate if they know you well, and or just got to ask. There's been a study called the DASH diet, which actually looked at ways to reduce sodium by what you eat. And DASH stands for Dietary Approaches to Stop Hypertension. And what they did in the diet, they put everyone on a meal plan that emphasized foods high in potassium, magnesium, and calcium, which acted like natural diuretics to lower blood pressure. And so in the meal plan, they emphasized foods that were sources of those minerals. So they encouraged eating a lot of whole grains, vegetables, fruits, dairy, low-fat or fat-free dairy products, nuts, seeds, and legumes, which were all great sources of magnesium, potassium, and calcium. At the same time, they said try to limit your intake of sodium and fat and sweets and added sugars. And they saw really great reductions in blood pressure. The DASH eating plan, this pyramid kind of gives you a representation of how many servings from each group the participants in the study were eating to get the effects of the DASH diet. They were eating about 8 to 10 servings a day of fruits and vegetables. So for someone with diabetes, you probably want to eat more of the vegetables, not, maybe more than half of those servings should be vegetables. So if you were trying to follow this, you don't want to be eating probably too many fruits, because it would be hard to fit them in a day and hopefully not cause your blood sugar to go up too much. Whole grains are emphasized, low-fat dairy, nuts and seeds, beans, small amounts of meats, and at the top of the pyramid were sweets, so small amounts of sweets and added sugars. Okay, now the third part of our ABCs, cholesterol. There are a lot of factors that affect cholesterol levels: diet, weight, physical activity, age and gender, and heredity. Now, some of these things we cannot control. We can't control our gender, can't control our age, our heredity, the genes that we're born with. We can control what we eat and our activity level and our hopefully our weight along with that. We know that with diabetes, often our HDL level can be low, our LDL level can be high. We call HDL the good cholesterol because it is a carrier protein. It transports cholesterol away from the heart and takes it to the liver, and then the liver breaks it down and excretes it. LDL we call the lousy cholesterol because that number, if it's higher, tends to increase our risk for heart disease and increase our risk for plaques in the arteries. It carries cholesterol towards the heart. And excess circulating LDL can damage the cell lining of the arteries. So we usually target LDL when we are trying to lower total cholesterol. We don't really want to lower HDL, we want to lower that LDL number. So what foods raise LDL cholesterol? Saturated fats, trans fats, and dietary cholesterol. The top two really are the ones that raise LDL cholesterol the most. So sources of saturated fat to limit would be meats, fatty cuts of meats, poultry with skin, solid fats like lard and butter. Seafood to a lesser degree has some saturated fat. It's pretty low compared to meats and chicken. Whole milk dairy products have a lot of saturated fat, so we encourage people to switch to low fat or fat-free dairy products. And then there's also saturated fat in some plant foods, coconut oil, palm oil and palm kernel oil. And I see palm kernel oil and palm oil used a lot in processed foods like cookies and crackers. You almost can't, it's really hard sometimes to find a cracker or cookie that doesn't have those oils in them because we're going to talk about trans fats next. They're trying to get away from using trans fats, so they're using these saturated fats, but these aren't good for you either. So, you know, the goal is to try to find, if you're looking for crackers or cookies or packaged foods like that, that are made with liquid oils and not trans fats and not saturated fats. Now, trans fats are created by a process where they take a liquid oil and they hydrogenate it to make it a solid fat. And manufacturers did this to make the oils more stable. It increases the shelf life and the stability of the oil. But what they found, though, with studies is that it raises LDL cholesterol levels and also contributes to plaques in the artery, just like saturated fats. And it hurts your HDL level. So trans fats are, you know, as bad or worse than saturated fats because they believe they also increase inflammation in the body. So look on labels for foods. If the ingredient label says hydrogenated vegetable oil, that's a source of trans fat. So even if it says 0 trans fat on the label, because based on the serving size, the percentage might be less than a gram per serving, so they can say 0. But there is still some trans fat in that product, and depending on how much you eat, you may actually get over a gram of trans fat a day. And the recommendation from the American Heart Association is you should aim for less than a gram of trans fat per day from, total from anything that you're eating. So if you are looking at commercially baked pastries, donuts, those kind of foods, often commercial bakeries use solid shortening in their fryers. So there's a good chance it's a hydrogenated fat that they're using. Unless you ask them, you can see what type of fat they use. A lot of the fast food restaurants have switched from hydrogenated oils to liquid oils, like McDonald's has done that. Doesn't mean it's healthier, but they are using a liquid oil instead of a trans fat. Fried foods, snack foods often have the trans fat in them, so you have to look. They are trying, I would say manufacturers are trying to get away from using the hydrogenated oils, but it's taking a lot of reworking of the recipes and the process that they have used to make these products, so it's taking time. And you may also find them in vegetable shortening or stick margarine. So what to do to avoid trans fat? Read your food labels. Try to limit or avoid eating out fried foods. Use natural unhydrogenated oils, so liquid oils. Choose foods that are made with liquid oils when possible. Avoid hydrogenated fats and saturated fats. And I've reworked recipes at home, you know, like my banana bread, I use liquid canola oil in it instead of using butter. So there's ways to often change recipes and use liquid oil instead. And also use soft tub margarines as a substitute for butter or for hard stick margarine. Now, dietary cholesterol, I said, to a lesser degree also can raise your LDL. So what you want to limit in the diet is food sources of cholesterol. So anything that was an animal or came from an animal is a source of cholesterol. So egg yolks, meat, chicken, fish, dairy products, organ meats are all sources of cholesterol. There is no cholesterol in foods that are plants or fruits, breads or grains. So unless they were made with butter or made with egg, there's not going to be any cholesterol in those foods. Now talking about fats, why are good fats so good? Well, the monounsaturated fats are not shown to raise, they don't raise LDL cholesterol, and they don't hurt your HDL cholesterol. And the polyunsaturated fats also do not raise LDL cholesterol. Omega-3 fats are shown to decrease inflammation, risk of sudden death, and heart arrhythmias. And those are the omega-3 fats from fish oil specifically. So looking at food sources of unsaturated fats, the monounsaturated are, here's some examples: canola and olive oil, peanuts, avocado, nuts like almonds, hazelnuts, and pecans, and then some seeds like pumpkin and sesame seeds are sources of monounsaturated fats. And your polyunsaturated fats are found in sunflower seeds, sunflower oil, corn, soybean, flaxseed and flaxseed oil, walnuts, and fish. Now, if you're trying to incorporate flaxseed for the heart benefits, depending on the form you buy, you're going to get a different benefit. So if you buy the flax seed, it has the antioxidants, it has the fiber and the cholesterol lowering effect, so you could grind it. Often people grind it, add it to foods. If you want the alpha-linolenic acid, you want to buy the flaxseed oil, and so that has the omega-3 fats in it. It's a component of the flaxseed. It doesn't have the fiber or the lignin component in it, though. And foods that are good sources of omega-3 fats, to get the marine type, the EPA and DHA, you want to buy the fatty type of marine fish like anchovies, herring, mackerel, Atlantic salmon, lake trout, halibut, and oyster. And the plant type, which has not been, you know, the studies where they saw reduction in sudden death and heart arrhythmias were actually done with the fish oils, not the plant type. And so there are probably more studies going on, I think, with the alpha-linolenic acid. But there are still the heart benefits there, it's believed. And you find that type in green leafy vegetables, flaxseed, canola and rapeseed oil, soybean oil, English and black walnuts, and wheat germ oil. So to send you home with some fat tips, use predominantly monounsaturated oils. Try to eat a fish meal 2 to 3 times a week. Look for products made with liquid vegetable oils instead of saturated fats or hydrogenated oils. And remember that all fats, even the heart-healthy ones, have a lot of calories. So if we eat more than we can burn off, they can lead to weight gain. So we still have to be prudent with our fat intake. Another tip for you to take home: choose whole grains. So what they found is that increasing intake of whole grains also can reduce cardiovascular disease, because the whole grain has B vitamins and fiber and phytochemicals that are not always present if the grain has been processed. So if you buy, polished rice or a wheat kernel that's been processed, you lose the bran or the outside of the kernel, which has the B vitamins and fiber that you just can't replace. So try to choose whole grains as much as possible. Also try to include more viscous, soluble fiber. When I was talking earlier about how soluble fiber can help slow down the digestion and the rise in your blood sugar after meals. And good sources are barley and oats, citrus, apples, pears, beans, legumes, broccoli, carrots, soy products. Those are all good sources of soluble fiber. So soluble fiber intake has shown to be able to decrease cholesterol levels. So it kind of acts like a sponge in the gut, so you don't absorb some of that dietary cholesterol. So it can lower your total and LDL cholesterol. It may help lower post-meal blood sugars and decrease blood pressure. Can help with weight loss by helping you feel fuller or help with satiety after you eat. It can help with regularity and overall improve gastrointestinal health by feeding the healthy bacteria that we have in our gut. Now I have a handout here on plant stanols, which naturally occur in many foods. They also have a cholesterol lowering effect. So you want to try to include a lot of the same foods that have soluble fiber have plant stanols in them. They help block absorption of dietary cholesterol from the digestive tract. So they also can help lower your LDL cholesterol without affecting your HDL. And here's some food sources. Again, the legumes, nuts and seeds, avocado, rice bran, some vegetable oils. And there's fortified foods you might see in the grocery store. Plant stanols are added to like orange juice and yogurt, and you might see, if you see a claim on the outside of the label that says cholesterol lowering effect, check and see it may have plant stanols added to it. I also have a few slides on here on pro-inflammatory and anti-inflammatory foods, since inflammation has also been linked to risk for heart disease. So foods that are considered pro-inflammatory to the body or can increase inflammation are foods that have refined sugars in them, like candy, pastries, sugar-sweetened beverages, highly processed carbohydrates like potato chips, crackers, donuts, oils like hydrogenated oils and partially hydrogenated oils, processed meats, saturated fats, and trans fats. So those are foods to limit to try to decrease inflammation. And these foods have been shown to decrease inflammation. Beans and legumes. So see, a lot of these are they're good for so many different reasons. Beverages like green tea, red wine, fish is anti-inflammatory. A lot of fruits like apples, berries, cherries, citrus, tomatoes, herbs, nuts, again, certain oils, canola and extra virgin olive oil, dark chocolate, and certain vegetables, bell pepper, broccoli, cabbage, garlic, green onions, sweet potatoes are all anti-inflammatory. Nuts, I was also going to talk about briefly, make a great snack, and they have the healthy fats. The upside is they're cholesterol free. They help with satiety, so they make a good snack for between meals. They're low in carbohydrate, so they're a good source of fiber and protein, B vitamins, minerals, healthy fats, and antioxidants. Now the downside is they are high in calorie, so you have to monitor your portion size. But including 1 to 1.5 ounces per day as a snack is something that you could try if you're looking for something to kind of keep off the hunger between meals. Now, how many nuts equals an ounce? It depends on the type of nut that you're looking at. So if it's almonds, 24 would be about an ounce. Brazil nuts, because they're bigger, you can eat like 6 or 8. So you can kind of use this guide if you are portioning out your nuts at home. And you can buy them unsalted, or you know, so you're not adding extra sodium to the diet as well. Okay, and here's the last slide, just to leave you with some heart-healthy shopping guidelines. When you're reading nutrition labels on food packages, remember to, you know, compare, looking at sodium and fat, and look for whole grains as much as possible. Try to choose foods that don't have a lot of added ingredients, like added sodium, added sugar, added fat, added salts. And as a guideline for sodium, choose foods that have less than 300 milligrams sodium per serving. When you are choosing and trying to compare, looking for higher fiber foods, cereals that have at least 5 grams of fiber per serving would be a good choice. And I'm talking about not total carbohydrate, but the dietary fiber, and you're looking at that on the label. And breads that have at least 2 grams of dietary fiber per serving would be a good choice. And there's a link there to Delicious Decisions. That's the American Heart Association, and they have a whole you know, online grocery shopping link that you can look at, and gives you tips when shopping for meats, or shopping for vegetables, shopping for, you know, all types of groceries, you know, what you can look for. And then I also have some other links here at the end for the DASH diet. If you want more information on glycemic index, American Diabetes Association has some information there. And of course, American Heart Association has some great information as well. So thank you very much, and I can take questions now.
Could you explain that word, oxidative stress?
Oxidative stress. So it's like the process when your bicycle's left out in the rain and it rusts. That's oxidation. That can happen in the body as well. There's processes that can cause oxidative stress, where there's, how do I explain it? High blood sugars are one example of something that can cause oxidative stress in the body. When we're ill, we can have more oxidative stress, and the body can try to, you know, fight it if you're eating, for example, a healthy diet. And so you're sort of combating it with antioxidants. Another thing that increases oxidative stress in the body is smoking, drinking. So there's certain lifestyle habits that increase oxidative stress in the body. If we eat a healthy diet, that's one thing that can kind of combat those stressors. It's basically like a stressor on the body. It's natural, and if you are in a, you know, healthy state, you can kind of combat it. When it gets a little bit out of control, that can lead to heart disease. You know, it's a process in the body, heart disease. We develop changes in the arteries and plaques, and you know, I wish I could explain it probably as well as a, you know, cardiologist could, but it's diabetes, high blood sugars can increase our oxidative stress, which can increase inflammation and kind of start that process of heart disease.
Please tell me more about hydrogenated oil.
Hydrogenated oil. So manufacturers, they would take, you know, back when they were trying to decrease saturated fat intake, decrease butter and lard and the use of those types of fats, they thought it would be maybe a smart idea to take liquid oils, which are healthier, and hydrogenate them. So it's a manufacturing process that solidifies liquid oils and makes them more shelf stable. So the shelf life of products with hydrogenated oils is longer. So it was good for manufacturers because the cookies would last longer, the chips would last longer, things wouldn't go rancid as quickly. So if you have liquid oils in your home, you know, if you leave them in hot places, they go rancid more quickly. But what they found with studies is that these hydrogenated oils, the structure of the oil changes, and in the body causes an increase in LDL cholesterol and lowers our HDL and can also increase inflammation. So it does, you know, bad things, basically. That's why they're banned in some parts of the country, and they are, you know, trying to be pulled out of the food supply as much as possible. They thought it was a good idea at the time when they were, you know, doing it.
We're told to eat a lot of fruit, but fruit contains sugar, and we're supposed to stay away from sugar. So.
Right. So that's the key is to, again, I always emphasize portion control. I would try to avoid juice because juice has all the fiber benefits taken out of it, and it's very easy to drink calories, so you can drink probably twice as many calories in juice than you would consume if you ate, you know, an orange or a whole piece of fruit. So the way to fit it in is some will eat it between meals, a small piece of fruit, if they like fruit, or they fit it in with their meal as part of the carbohydrate they're going to have at the meal. And just, again, watch the portion. And another thing you can do is check your blood sugar, you know, if you're eating more fruit, just to see if you're able to handle it, you know, if you're not going up too high after that type of meal.
I forget, how many grams of carbohydrates can you have at each meal? Say you have 3 a day.
Well, you know, when we talked about individual meal plan for each person, there isn't a set amount that's right for everybody. Usually, you know, we usually don't probably recommend less than, you know, 3 servings of carbohydrate or 45 grams of carbohydrate at a meal. But someone who is maybe trying to lose weight might do a little bit less than that or spread it out a little differently. They might have maybe some at snack times. If you're not having snacks, then you probably need to have at least 3 carbohydrate choices per meal. And we didn't really talk tonight about carbohydrate counting, but that is something we teach at our program, or, you know, one-on-one. But the minimum carbohydrate per day is 130 grams is the minimum recommendation. You know, so however way you divide it up.
When I look at some of the packaged food or like canned food and look for low sodium types of food, often I see that while the manufacturer would lower the sodium content, at the same time the potassium content goes way high. So I'm interested in your thoughts and comments on what are the risk benefit of lowering one, but yet to compensate for the taste, I think they up the potassium so much.
What type of food did you notice that on?
I think I've seen it in soups. I've seen it in some of those frozen, like dinner.
Well, some of the salt substitutes on the market are potassium chloride, so maybe they're using some form of that in place of salt, which wouldn't necessarily be a bad thing unless you are restricting potassium. Like some people with kidney problems have potassium restrictions on their diet. So, but a lot of foods don't list the potassium content on the label. It's not a requirement. Sometimes it's on the label, sometimes it's not. So the food that you saw, maybe because it's an added ingredient, they listed the potassium just for safety. What I notice often when they reduce sodium in foods is sometimes the fat is higher, or if it's a low sugar option, the fat is higher, or if it's a low fat option, the sugar is higher. You know, they raise something somewhere else to make up the taste.
I noticed a lot of mention of carbohydrates, but how do they relate to calories? Like, I was told to also watch calories, and that would affect my blood sugar as well.
Well, if you are watching your portions on carbohydrates, you probably are restricting calories. I mean, we didn't talk about specific calorie levels here or anything like that, but often where I start with people, rather than give you maybe a real specific meal plan, is just talk about cutting portions at meals, cutting portions of what you normally eat, and maybe looking at snacking, or are you eating dessert every night? I mean, there's probably some big things you can eliminate to cut calories. Maybe soda, or the frappuccino you get every day on the way to work. You know, there's probably things often people identify for themselves what they can change. They know what they can probably change.
Well, essentially, I'd like to put on some weight. I was wondering if you have any recommendation. I was diagnosed about 3 or 4 years ago, and I'd like to put on some weight, and, you know, if there's any recommendation there.
Well,
maintaining like a 2,000 calorie a day diet or something like.
Yeah, well, you really should see someone one-on-one for maybe a meal plan or some guidance on what you're eating. Maybe you're overly restricting. Sometimes when people are diagnosed with diabetes, they overly restrict carbohydrate, or they're not sure what to eat, or they misunderstand how much they're supposed to be eating. So if you're losing weight and that's not your intention, yeah, you might have to sit down maybe with a dietitian and have sort of evaluate, keep some food records and evaluate how many calories you're taking in. But some of the things I talked about tonight, like nuts, are a great calorie source. If you're trying to, gain weight, you can add some of those higher calorie things in as snacks to add calories without adding a lot of carbohydrate.
I would like to find out regarding the eggs, the egg yolk and vis-a-vis the whites. So we can eliminate the yolks and have whites, or have the whole egg?
Well,
in terms of cholesterol.
If you have heart disease or high cholesterol levels, the recommendation is to limit your egg yolks to 2 per week. But the egg white by itself is just a good source of protein and doesn't have cholesterol, so you could eat that every day if you like.
You have only the whites of the egg?
Yes, every day. Yeah, and up to 2 yolks per week.
2 yolks.
And I think that including some protein at breakfast is a great idea if you like egg whites. You can make a scramble or put vegetables in it. Because so many breakfast foods are just starch or carbohydrate. There's fruit and cereal and toast, and so if you can find a way to add some protein there, it's a good way to, I think, keep your blood sugar from spiking up after breakfast. Thank you all for coming. Thank you.
For those of you with